Welcome everybody to EHC Now. Last week we aired an interview with Dr Michelle Lavin, who's a coagulation haematologist from the Irish Centre for Vascular Biology in Dublin. She gave a lot of insight into the difference between having von Willebrand disease and having reduced von Willebrand factor levels, which range between 30 and 50%. This is important because the majority of people who have reduced von Willebrand factor levels are not diagnosed with a bleeding disorder, although they experience many of the same symptoms. This week we continue our talk with Dr. Lavin, in which she stresses that a large percentage of teenage girls who experience heavy menstrual bleeding, which is one of the most common symptoms reported with von Willebrand, do not get referred for hemostatic testing or for von Willebrand factor screening. What can we do to change this, and how can we educate both physicians and the community? Find out now in EHC Now.
So, one of the things that you mentioned was the 89% self-reported heavy menstrual bleeding, but only 60% went to the clinician and got further information. The other one was only 8% of teenagers who go to clinician with heavy menstrual bleeding get
von Willebrand screening. Yeah, so that was, the first data was from our own study where we looked at 120 women with low von Willebrand factor levels. We found that although 90% of them or 89% of them reported heavy menstrual bleeding, only 60% ever mentioned it to a doctor prior to finding out they had low von Willebrand factor. And we shape our accepting of periods or how heavy periods are by what our parents, our mother tells us and what they have experienced, what our sisters have experienced, what our friends have experienced. But people are slow to discuss their symptoms and slow to recognise what's abnormal. So I think the big take-home message, if anyone is listening to this, if you're bleeding longer than 7 days, if you need to change your pads more frequently than 2 hourly, or your tampons more frequently than 2 hourly, or if you're passing clots, that's not normal. Okay, so you need to actually get that checked out. And if a doctor tells you that's normal, don't accept that and try and get hemostatic testing. Because 1 in 5 women will have heavy menstrual bleeding at time of periods. And of those women, that 1 in 5 women, 1 in 5 will have a bleeding disorder. So if you look at that in Ireland, we have about 1 million women who are between the ages of 15 and 45 based on the census from 2016. So that means that there's 200,000 women in Ireland who have heavy menstrual bleeding, of which up to 40,000 could actually have an underlying bleeding condition that's contributing to it. These are huge numbers. It's actually beyond haematology. It's actually a public health issue. So we're working really proactively with, and we had students working on a student innovation challenge and how to outreach to the community and to the public about what's normal and abnormal, and some great ideas feeding back. We're hoping to take that forward into a public awareness campaign for both physicians to recognise whether it's abnormal and for people in the community to recognise when their periods are actually not normal.
Yeah, I think that's a very, very important point. I know there is the kind of the male versus female clinician and who you get is what you report, but the importance of just saying it and responding to the issue. But in terms of the education piece, what do you think is the best way to get that across to women, to explain you need to talk up about this?
Yeah, so I think the demographic that are particularly vulnerable are teenage girls. And you mentioned one of the studies that we referenced, which was a study of the National Inpatient Survey in America, looking at the public claims database, looking at the amount of teenagers that reported heavy menstrual bleeding and have been coded with a diagnosis of heavy menstrual bleeding. So it's just under 24,000 girls who had heavy menstrual bleeding as teenagers, and just under 1,000 of those had a blood transfusion or had severe iron deficiency or required admission. That's an amazing impact on your life.
Yeah.
If you got to that point that you needed to go to hospital or to have a blood transfusion as a teenager for your periods, something needs to be done about that. That's gone too far already. Yeah. But of those, only 8% of the overall 24,000 had von Willebrand factor screening, and 16% of the girls who were admitted or had a transfusion or required iron had von Willebrand factor screening. And according to the 2001 American College of Obstetrics and Gynecology guidelines, all those girls should have been checked. Because if you're a teenager with heavy menstrual bleeding, we need to be checking and making sure that we're not missing an underlying bleeding disorder. So I think they're really, for me, the real target demographic that we need to focus on, because then we can catch people and identify them as having a bleeding disorder before they get pregnant, before they have an operation, before they need a tooth out, and try and change things rather than waiting for people to bleed their way to a diagnosis.
Yeah.
So that's why we engaged with in the Royal College of Surgeons in Ireland. We run a summer research school, and we had a recent student innovation challenge where we put that task out to students, and these are 3rd and 4th month students, so they have a better grasp of social media than I do. And we got some really great suggestions back about, you know, putting information leaflets, just not out in the community, but actually on sanitary, like the aisles where sanitary products are being sold, or like in, you know, GP practices. A really good one was in, maybe other countries don't have Freshers Week in college where people start off in college, but giving out like sanitary pads or tampons and information about what's normal and not normal. I personally think it'd be great if some of the like Tampax or sanitary suppliers had a sticker on their pack, and if you're using a box of Superplus tampons, you need to do something about it. You shouldn't be getting through that much in a month. You know, so there's, I think by virtue of the women picking up the heaviest, the tampons, the biggest pads, they're the women we need to be kind of saying, have you thought about this? Yes, exactly.
Wonderful, thank you. So I could pretty much talk about this, and you could clearly talk about this all day, but we have very limited time. So thank you very much for joining me on this edition, and thank you very much.
Great. Thank you so much.
Cheers. Thank you.